Thanks, Rebecca. Yeah, like Nick, we're very, very pleased to be part of Closer. It is a very important part of our ethos and what we want to achieve through Generation Scotland. So what I'll do is just tell you a little bit about what we've been doing before, during, and after the pandemic. And the next slide just sets out what our mission is. It's very similar to ALSPAC in many ways. We're seeking to improve the health and well-being of current and future generations. And we're trying to do that as a partnership between researchers and volunteers. The way we're set up is somewhat different from ALSPAC, and I'll try and explain how as we go along. But the vision on the next slide is, Chloe, yeah, it's to just emphasize the fact that this is very much a longitudinal study. We're trying to follow the lives of people in Scotland as individuals and families, and to do so from childhood to old age. It's very much, as I say, a partnership between the volunteers and the researchers, because we're asking a lot of them, and in order for us to support their involvement in the study, we want to feed back as much as possible to them too. We do this by combining responses to questionnaires and then really building on the fact that in Scotland, our NHS records are longer standing and more detailed than they are elsewhere in the UK. So we're using that to best advantage. And we're combining that with innovative laboratory science, including genetics and data analytics. And just on the genetics side of it, the reason I think that there's added value from doing the studies with a biological component to it is that genetics is something that we can measure very accurately, remarkably cheaply, and consistently across an entire cohort. And that does make interpretation of social science questions somewhat easier than it would be if we didn't have that biological information. Very much, it's very important that we respect every single sample, every piece of data, and we hold those safely and securely. We're very strong on open science and sharing our findings. And we want those not just to do good science, but also to influence health policy and improve lives. So that's very much the vision, and we try to think about that every time we do work with Generation Scotland. The next slide just talks a little bit about the team, because back in 2006 and 2011, when we did our main recruitment, it was a big team. And they were all based in the clinic, interviewing people, taking samples, taking measurements. And after that period, our funding pretty much tailed off. And by 2017, we were really in care and maintenance mode. It was me, Rachel, and Archie Campbell, who's our Chief Technology Officer. But thanks to the Wellcome Trust, in late 2019, we were able to expand the team from 3 to 8. And then during the last year under COVID, we've gone from 8 to 16 in total have been working on it. Many of them just seconded or working with us short time. But some of those people have never met each other face to face, and that's been quite weird. But somehow we've managed it. And a great credit to the team that they've brought new people into the team and made them both welcome and very productive. The next slide just says a little bit more about that core cohort. So the core cohort of Generation Scotland comprises 24,000 adults. They're in 7,000 family groups, recruited between 2006 and 2011. And they came to a clinic, had a full workup, a bit like ALSPAC, clinic measures, detailed health and well-being. We've always put a big emphasis on mental health and psychosocial questions, and they're quite deep and very much part of the core of what we do. We also collected biological samples, blood and urine for genetics and biochemistry. And then this key aspect of Generation Scotland is the linkage to the NHS Scotland health records, and also vitally important, consent to recontact for follow-on studies. And those follow-on studies are really driven far more by investigators than they are by the Generation Scotland team themselves. The next slide just says a little bit more about how this works. The NHS Scotland data is kept safely and securely by the NHS, but we have consent to use the Community Health Index, which tracks individuals from birth in Scotland through to death, and to use that to link the Generation Scotland data, one with the other through safe walls and using trusted research environments to allow that to happen. By being able to tap into the historical data that resides within NHS Scotland, that cohort of 24,000 individuals has collectively about 200,000 person years worth of health data and tens of millions of data points for every single transaction with the NHS, be it through hospital or at the GP level, from samples collected and laboratory tests made, all the way through to prescription data and encashment. And on our side of the firewall, we've got all of our questionnaire data, our clinic-based measures, and samples for genetic, epigenetic, biochemical, and proteomic analysis. The next slide will just say a little bit more now about what we're planning to do next. So Next Generation Scotland is basically the funding from the Wellcome Trust, who've given us a reward under their longitudinal population studies program to expand the Generation Scotland cohort over the next 5 years, and to increase the cohort size to at least 40,000 or more volunteers. The critical issue here is that we'll be recruiting actively from age 12 and up. And as well as all the NHS Scotland data, we'll be adding administrative records. We'll be doing this online for efficiency. We'll be doing a lot of passive data collection through mobile phones and other devices. And we'll be doing sample collection post by post, all designed to be able to be more inclusive, to be more efficient and cost effective, and to adapt to the fact that we're looking at a younger age group, but also retaining that multi-generational principle. We're doing feasibility studies on how to use the neonatal blood spots that are routinely collected. We have our primary care linkage now in place. We will soon be able to get all hospital-based imaging, and we will be increasingly going towards the collection of administrative data sets, which will be particularly relevant to the social sciences and metadata from mobile phones and other wearables. In the next slide, though, it's the transition from me to Chloe, who has, as you gather, been driving the questionnaires that we've been launching under COVID, under the headline COVID Life, and I'll pass over to her to take over from here.
Thanks, David. So while the Generation Scotland team had to put our planned recruitment of the next wave of participants on hold because of COVID last year, because we had been planning to use remote methods of data collection, we thought we were quite well positioned to turn our focus to carrying out online surveys to understand how people were coping and how they were doing under lockdown and as the COVID-19 pandemic progressed. And in the last year, we've set up 3 sets of studies. So there's COVID Life, which is looking at adults in the UK, Teen COVID Life, looking at teenagers in Scotland, and Rural COVID Life, looking at those living in rural communities in Scotland. So I'm going to tell you about each of these studies, who makes up the sample, and at the end, I'll give you a little bit of an idea of the sort of things we found with this data. So here's the timeline of our studies. Now, let's see if I can get my... We started recruiting quite early into the, here we go. We started recruiting quite early into the pandemic. So our first study took place about 3 weeks after that first lockdown. Here we are now. As you can see that for quite a large chunk of the last year, we've got data from at least one of our studies being collected at any one time. And unfortunately, the pandemic's not over. So we are also planning additional studies in the future as well. So this is just an idea of some of the topics that we've assessed throughout our various different COVID Life studies. You can see most of the topics are assessing mental health and well-being. So we have assessments of things like depression, anxiety, loneliness. But we've also been interested in things like COVID health, so whether people think they've had COVID-19, what symptoms they had, and whether they're following the rules. So whether they're following the rules, whether they agree with the rules, their opinions on the rules, and information about where they get their sources of information about COVID-19 and who they trust, things like that. So we've assessed quite a lot of different topics, and most of these topics we assess in in more than one of our studies, but there are certain topics that we've focused on in specific groups. So for example, in our teenage participants, we have whole sections devoted to what it was like not being at school last year, what it was like coming back, how it was, what they thought of exam cancellations, things like that. And we asked our rural participants questions about things like how internet connectivity has been affected, if it's not very good, how that's affected them during COVID, how their sort of transport and accessibility has changed during COVID. And when we're designing these surveys, we've tried as much as possible to harmonise with other population health studies in the UK and beyond as well. And largely a good proportion of the questions comes from the Welcome COVID questionnaire that you were hearing about just within the last half hour. So we have a lot of different topics assessed in our COVID life studies. So the first one I'll talk about is COVID life. That's the first one we set up. This was designed to understand the psychological, social and economic impact of COVID-19 in adults. Our first COVID life study recruited just short of 18,500 participants, and we followed these participants up now on 3 occasions. The last occasion, we just got just short of 10,500 participants. Now, the survey was open to participants all over the UK, but because of our recruitment strategy, the majority of our participants are from Scotland. We found that about 2/3 of our participants were female. So most of our participants, and this again reflects our recruitment strategy, most of our participants were middle-aged and older, but we do have reasonable numbers of younger people as well in our COVID life study. I've got the timeline of when we carried out the COVID life study at the bottom. So our first wave of data collection was between April and June last year. So that was during that very strict initial lockdown. We then carried out our second study in July and August time. So that was really when the restrictions had eased somewhat. It was probably, since the start of the pandemic, that was the least amount of restrictions we've had. And then we've not long closed our third COVID life study, which was carried out in February, which was again in another lockdown. So we've got 3 waves of data during a lockdown when the restrictions have eased, and then during another lockdown. Importantly, with COVID life, we invited Generation Scotland participants to take part, and we have 4,750 Generation Scotland participants in the COVID life sample. And this means that you can link COVID life responses back to the information collected on Generation Scotland participants many years before the pandemic. So we have things like baseline clinic measures, which are things like physical measures. We had cognitive tests, things like that. We've got a wealth of sort of information on health and well-being from questionnaires they filled out in Generation Scotland. As David was saying, we've got information, we've got data, genetic data and biochemistry data on these participants. And importantly, we can link responses from COVID life to their NHS health records as well. So the second study we've been carrying out this year is the teen COVID life study. We designed this one to give young people aged between 12 and 17 living in Scotland a voice to tell us how they've been coping and how they're adapting during the COVID-19 pandemic. So far we've carried out 2 teen COVID life studies. The first one recruited 5,500 participants, and the second one recruited 2,200 participants. Now, unlike COVID Life 1, where we recruited a sample and then followed them up 3 times, we recruited 2 separate samples for COVID Life 1 and Teen COVID Life 1 and 2. But there are 761 participants who've done both. Again, we find that about 2/3 of the sample are female. I've got the timeline at the bottom there. So we carried out the first Teen COVID Life study during the summer term last year. So that was when most school pupils in Scotland were doing their schoolwork from home. The second Teen COVID Life survey took place in autumn, and that was the point at which most school pupils were returning to school for the first time since the start of the pandemic. And we're now next month planning our third Teen COVID Life survey, and that will be a year after our first Teen COVID Life survey. And what we'll do is we'll invite participants who did Teen COVID Life 1, Teen COVID Life 2, as well as new participants. So as part of Teen COVID Life, we asked participants how much COVID-19 had changed their daily routine, and they could answer not at all, a little, some, and a lot. We also asked this same question to our adult participants, and you can see the results here. And what's really striking is that they're almost identical between the teenage participants and the adult participants. Unsurprisingly, 2/3 of the participants in both studies told us that COVID-19 had changed their daily routine a lot. Now, this will not surprise any of us, but what we were finding is that there was quite a lot of studies being carried out to understand how adults were coping during the pandemic. But generally, there was less research into sort of adolescent participants, despite the fact we're finding that it seems like their daily life has been impacted by COVID just to the same level as adults. So that was sort of reiterating to us why it was so important to carry out a study specifically focused on understanding how young people are feeling during COVID-19. And the final study we carried out this year was the Rural COVID Life survey. So in Scotland, rural communities actually make up about 17% of the Scottish population, but they're very much underrepresented in health research, and doing online surveys partly overcomes those challenges of doing health research with rural communities, because you're not having to do the difficulty of getting to and from rural communities to take part in health research. To make sure we were asking questions that were, I guess, relevant and appropriate to rural communities, we actually worked with rural organisations to come up with the topics and the questions in our Rural COVID Life survey. So we asked them what were the issues they were facing, and that was used to help us design the survey. So the survey was actually assessing the issues that rural communities face anyway, and how this is changing under COVID. So we had just over 3,000 volunteers complete the Rural COVID Life survey. Again, we found that about 2/3 of the sample were female. We found, just like the COVID Life sample, most of the participants were sort of middle-aged and older adults, but we also had some younger participants as well. And the Rural COVID Life survey took place between October and November 2020. So that was the studies that we've been carrying out this year. I thought I'd give a very quick summary of the sorts of things we found using the data. So in COVID Life, we found that rates of loneliness tend to be higher in periods of lockdown than when restrictions ease. We found that life satisfaction was considerably lower in lockdown 1 compared to previous national levels, and this improved somewhat when the restrictions eased. In Teen COVID Life, in our first survey, young people told us that they were going to bed a lot later than normal, and that their quality of sleep was affected. In survey 2, teens told us that they were not only following the rules on wearing face coverings, but actually they were actively in support of these rules as well. In Rural COVID Life, a substantial proportion told us that they were having difficulties or had poor internet connectivity, but connectivity was extremely important for them to be able to do their work and socialise during the pandemic. But it wasn't all bad news. Rural communities also told us that their sense of community had improved during COVID-19 as well. So we have, from the 3 studies, we have quite a wealth of data, and we have information on lots of people and lots of different groups. And the Generation Scotland team are working away on carrying out some analysis on this. But Generation Scotland was always designed to be a resource that researchers can use to answer important questions about health. So this data is available to researchers to apply to access. You can apply to access for data for COVID Life, Teen COVID Life, Rural COVID Life, but also all of the Generation Scotland data that David talked about earlier. So if you're interested, it is a relatively easy process, and we've got quite a lot of information on the Generation Scotland website that you can use if you're interested in applying. It's generationscotland.org/for researchers, but also feel free to get in touch with anyone at the Generation Scotland team if you have any questions as well. So just before we finish up, I'm going to pass back to David, who's going to tell you about what we're planning to do next.
We're now back on track to start recruiting adolescents. And we've got REC approval to do so online from age 12 and up. It's going to be postal sample collection. We've got approval for data linkage, and we've got approval for our passive data collection. So the next slide just says that it's a thank you to a fantastic team, lots of funders and partners, including not least ALSPAC. It's been great working with them over the last year in particular, but lots of other cohorts, many of which come from a very much social science background. Children of the 1950s in Aberdeen, the Shine Network through Glasgow, Healthy Aging in Scotland, amongst others. And what we're able to do is to bring into those studies the more biologically focused approach, but also our expertise in data linkage, particularly NHS and administrative data linkage, to complement and supplement the kind of questionnaire-based expertise that they have, and which has been very helpful to us, Chloe and others, in formulating the questionnaires that we've been putting out over the last year. So I think there's just one more to say. That's where you can find the information, and do get in touch. And to emphasize what Chloe said, we are primarily a research platform. We do not have a huge gamut of professional academic researchers behind us. We rely on people coming to us and saying, we like what you've got, but we would like to ask some more questions. Here are the ones we'd like, and we'll try and do that for you, and then give you back the data. Okay, so thanks, and if there's any time left, happy to answer any questions.